go into the panel discussion. Let's bring our three speakers up here. I know some of you have been answering some questions in the chat. Arup, what were your questions and what were your answers?
I think there were the questions about, how much did it cost to get started up on crowdfunding, and some questions about some of the different platforms. And I think on the platforms, picking up a little bit on what also Craig was talking about, and we've got, I think, collectively experience on multiple different ones here. I think it's a bit that could be a nice one to start with. And there were some other questions on the costs, but I'd love input from my fellow panelists. I'll talk on the selection of
on the choice of the platform.
Yeah.
Okay.
Yeah.
Leah, do you want to comment on that? What was your selection criteria? How did you pick the one you picked?
Well, it's really interesting because I actually know one of the founders of one of the more popular platforms, but we were rejected. And we were rejected from a bunch of the other ones. The top 5 said no. And this was also during COVID. And so I'm like, you don't want to do something for the doctors, the frontline people who actually are doing the work and took a Hippocratic oath. And they're like, we're only doing medical things, during COVID. I'm like, this is a medical thing, but it was kind of a weird concept of a digital identity. People outside healthcare don't understand the pain that we go through with credentialing. Crowdfunding is painful too, let me tell you. But yeah, so what I actually did was all of these rejections. I'm like, screw this. I'm going to the Fundopolis or the FINRA website, and I'm going to go down the list, and I'm just going to apply to them until they say yes. And so ABCDEF hit Fundopolis. And that's who we ended up doing our crowdfund with. And so, all of the people that invested, except for maybe 6 or 7, were people that I had personally spoken to at some point. We tried some ads, wasted some money there. It was really a community-driven effort from the start, direct messaging, finding people who are feeling the pain and showing them, the solution. So there's 51 portals out there. All take different variations, some percentage of the fundraising of the raise, and then some of them take some equity. And, you have to get a lawyer, you have to get an accountant. So, all in all, we probably spent around $70,000 outside of that 7% that was taken by Fundopolis to do the crowdfund. When you think about I kind of had to build a little sales force to help with outreach and stuff like that, and some advertising stuff that actually was kind of flushed down the toilet. So yeah, that was my experience.
Craig, how did you select yours?
We looked at some data regarding the different crowdfunding portals. I wanted to go really with a crowdfunding platform that had a track record of raising a lot of capital. So it was Start Engine, WeFunder, and Republic. And we looked at costs, and we talked all did the song and dance with all the different representatives. We were leading towards Start Engine at one point. We ended up, deciding WeFunder. And so I don't think that, I don't know if I'd really change my decision. I think hindsight vision's 2020. If we did it again, we would likely try Start Engine, unless there were these 51 others that Leah's brought up that we look at. But I do think that, look, we weren't absolved from responsibility ourselves of things that we could have done better. Again, we had no money to spend. And even though you can draw down, some of the funds that were raised, I think on WeFunder, we had maybe one opportunity to do that. And I just didn't want to until the end. And so we were very modest with our spending. Our agency that we had definitely was not one that had done this over and over. And frankly, we did mid-campaign switch to a firm that we had done a lot of vetting of, to spur additional raises, and they had a goose egg in 4 weeks. And so we got rid of them. And that's with like very sophisticated, experienced digital marketing experts who had looked at these different competing agencies that were going to do this. And they had slides talking about all their experience. And so then we ran into the election. And fortunately, at the end of the year, we raised a little bit more. So that's to answer your question, how we went about it.
Sure.
Again,
yeah, go ahead, Arup.
I'll just share my experience here with both Republic and Start Engine. The first piece is needing to find investors who either have empathy, understanding for what is the pain point that you're solving, or really see you as making a ton of money. And that's like, okay, this is a no-brainer that I want to invest in that. And I think for much of what we do in healthcare, people don't normally see that as being a big money maker. Maybe, you know, when somebody's in the pandemic here saying, okay, the pharma company's got the first to market with the vaccine. Okay, that could be something, but that's not going to be funded through the crowd. So a challenge for us is really building that empathy. And I think that when you have a B2B solution, you're further distanced from people in the crowd who can understand what you're doing. Now, for us, we were fortunate also that we're here empowering frontline staff, and people, especially through the pandemic, have developed growing empathy for what the frontline staff need. And when we did our first campaign, was introduced to crowdfunding through angel investor Jason Calacanis, and he introduced me to the folks at Republic. And so for me, there wasn't a whole lot of science on that first one. It's like I met Republic, there was a resonance there. We did a campaign on there, and what we were thrilled about is that we had end users at our clients who were then investing in us. There was an analogy here, and the analogy was that when we tried to go to traditional venture capital early on, a lot of them were like, okay, you're in this kind of, you know, green field, this white space. Is there really a there? This seems obvious, but why hasn't somebody else done that? And so the institutionals were balking. But then there were funds like, you know, I think one of your colleagues here, you know, the Global Health Impact Fund, a fund that is run and the LPs are all physicians. And then physicians were like, hey, I get this. I understand this pain. That's why I want to invest. And, you know, Global Health Impact Fund invested in us. Similarly, on Republic, we had nurses and doctors and ancillaries who came in and invested, and they created a social movement. And that social movement that was more organic drove more growth than the Facebook ads or something like that. It really had this kind of organic piece to it. The other ones that helped us to really bump up that, you know, I like how Leah showed that graph on how, hey, here's our growth. And then here, like towards the end, there's that FOMO and we get this bump up. And when we saw our history, we could see these intermittent bumps, and the bumps were also coming around when other third parties like Angels and Entrepreneurs or King's Crowd, these third parties that kind of looked at crowdfunding would feature something about us and talk about us. And that would get other people on the crowd kind of, oh, hey, somebody else is talking about them. And that was helpful to us and get these bumps. And I bring up these examples because I had, now when we did the second crowdfund we did on Start Engine, there I would also then say the difference in kind of personalities of the platforms. Republic is one that fosters a lot of dialogue between investors. And you can see that conversation happening where Start Engine rather just kind of stacks it and buries it. It's not as organic or facilitating of community. Republic is also one that I feel has a lot more interest in driving impact. So things like healthcare and driving improvements for everybody, that's something that's exciting to them, or environmentally oriented companies. Whereas Start Engine, I felt, was much more about the money. Let me just show me how you make the money. And what we see here is that when we did our next round on Start Engine, we raised more money than we did on Republic, but from a much smaller number of investors. And I, in retrospect, and what I heard from some of our Republic investors is, why did you come back and raise this round on our platform? because you already have 5,000 people that are following you and you could build on it. And on Start Engine, you don't have anybody following you.
Started from scratch again.
And you're starting from scratch. And I went into it thinking that, oh, on Start Engine, I'm opening up to a whole new base of investors. But I had to start from scratch on that. So if I did it all again, I would go back to Republic. And that was one of the questions that somebody asked on here is, you know, Start Engine Republic, what would you do? Okay. I would go with Republic. And the other piece that I would put in, and Craig, this might make you feel good, is that one of these third parties that did one of these podcasts on us, they were asking about our experience. And they said that really, you know, what we see the greatest growth in crowdfunding on the best platforms, their recommendation was WeFunder and Republic, for whatever that 2 cents, whatever that's worth.
Leah, what was the best thing that happened on the platform or during this process for your company?
It was coming towards the end, and some of you know, what I like to call our white knights said, we need to get this moving, and they all started calling each other and calling, you know, all their friends and saying, we only have 48 hours left, we only have 72 hours left. And so that got people excited, that FOMO and stuff like that. So it really was truly a crowd fund, you know?
Yeah.
And, you know, I see some questions in the chat, you know, people are asking, you know, what's the risk of this and stuff like that. I mean, as with any early stage startup, you're investing in the founder and the founding team. And do you trust them to be able to execute on the mission that they're talking about? You know, there's risk. It's high risk. Any, you know, most startups fail. And so, you know, there was also another question about not follow on investments, but, you know, further rounds. Is a crowd fund going to hurt further rounds? And, you know, I get mixed opinions on this. Some people say, oh, you know, you did a crowd fund and, you know, you're going to have a hard time finding funding. And I'm thinking to myself, you know what? I actually think that these are some institutional investors who are starting to get nervous that the real deals are going to be taken by the crowdfunding. They're realizing that, you know, the friction that they've placed between, you know, their pocketbook and the founders has led the founders to crowdfunding. So I think it's becoming more common. I think especially when you have like a marketplace play and a network play, like for us, you know, we really need as many doctors as possible to pick this up and use it in order for it to be valuable. And so it made sense for us to do a crowdfund because we really want this to be a true decentralized autonomous organization of doctors. And so, you know, our fundraising reflects that, how we built our app in a decentralized way reflects that, and how we move forward, you know, reflects that. So. Right.
So Craig, what's your take on, you know, it's going to spoil your next round for VCs? What's your take on that?
I mean, like, look, what Leah said, I mean, and this happened this week with a law firm. It used to be I'll say excuse or reason that, oh, if you do crowdfunding, you're going to have all these investors on your cap table. There's no way a VC will do that. Well, then SPVs came about. And so that removed that reason and that excuse that, hey, it's not multiple investors on your cap table. It's one line item with, at least in our case, in WeFunder, a very credible, proven entrepreneur with exit as the lead investor who is representing that cohort of investors. And so now it's like what Leah said, oh, well, it demonstrates you have so many problems raising money. And look, I'm going through it right now with different institutional firms. I'll check back with me in Q1 next year, but I find that hard to believe when there's context. It may be a perception in some ways, I think maybe in Silicon Valley, but look, the only venture capital, raising venture capital isn't the only way to capitalize your business. Yes, medical companies and healthcare fields can be capital intensive, especially in a pre-revenue state. My last company, we raised 15 million, and it wasn't because we didn't try to raise venture capital money. There were some dynamics at play that precluded it. I wouldn't wish it upon anyone, but we raised 15 million largely through angel investors, and then we bridged to a multi-billion-dollar strategic. And so there are other avenues. Most folks on this call are much more adept at getting early grants written for SBIRs and STTRs to get you $250,000 or 750,000. And look, there's a lot of capital out there, and family offices can be difficult to identify or find out where they are. But, that's where you got to, in my opinion, rely upon your advisors, your law firm, and the folks that are really experienced and have broad relationships, even your CPA firms that you have representing you.
Yeah. Well, talking about NIH grants and SBIR grants, make sure you attend the class next week. Arup, if you have to do it again for a third round, would you still continue doing this, or would you go back to VCs?
So we're actually in the midst of talking with VCs about really the balance. I'd like to bring on another $5 million, or I want to bring on more, and so we're in some discussions there. And when we look at crowdfunding, there are companies that are on the Reg A Plus, which is very similar to kind of like a public offering, that are raising $50 million from the crowd. So you certainly can raise more. That does bring a whole lot of another level of complexity when you venture into that area. But then there's also, when you've got the institutionals behind you, they have kind of maybe quicker access to a lot of capital that you may need at those later stages of the game. So what I've seen is that by going to the crowd, it's given the institutionals a different type of affirmation that there's a value here. That, hey, you've got the eyes of all these people looking at it, and maybe they're not professional investors, but they're seeing something and they're putting their hard-earned money into it. And we've seen that that's gotten their attention of, hey, it's creating for them a bit of FOMO as well.
This question is for Leah. Now yours is a very unique company, right? The users are going to be physicians. Let's say tomorrow we start a crowdfund, a platform, InnovatorMD crowdfunding platform. By the way, we are exploring that. So there may be 52 crowdfunding platforms next year. But do you think it is possible that you totally avoid a VC round? Is that possible?
Yeah, I mean, I think that's part of what I was trying to say. People are like, oh, if you do a crowdfund, you're going to be tainted and nobody's going to want to invest in you. Well, I think those are the boomers talking, and they're like, this is like their old way of thinking, and those days are done. And you're going to miss out on early rounds if you think that way. Sorry,
Yeah.
But that's just me. So.
And is it also the case where the investors think, the professional investors think that, oh, this company is not going to be $1 billion company, and so would that be a criteria for companies to say, hey, this is not going to be $1 billion company, maybe $100 million company, and so for those reasons, crowdfunding would that be a better idea, Leah?
I mean, Peter Thiel, who I had the pleasure of being able to see him speak in person last night, actually, in his book 0 to 1, he said, the most powerful businesses of coming decades will be built by entrepreneurs who seek to empower people rather than to make them obsolete. Excuse me. I think that the future is becoming decentralized, sorry, excuse me. So I think that in general, these centralized systems that they're a thing of the past. So $1 billion company is going to need to empower individuals. So I don't think that the old concept of vertical integration and you have to own everything in order to generate revenue is really the truth anymore. And so I don't necessarily believe that. We see, Doximity just IPO'd, and I think their value cap was like 14 billion. And they're just like a social app for docs. That's just like a news feed kind of app. They have this fax feature as well, but billion-dollar companies are going to be more common, and they're going to be less of the traditional things that we used to have, the less of the brick and mortar stuff. Personally, that's what I think.
Okay, Craig, what do you see in the future? More democratization?
I think that first of all, for what I would term lifestyle businesses that don't care about being a unicorn, and quite frankly, you could be generating $250,000 of free cash flow and quite happy as a small business owner. I think crowdfunding is an excellent portal for that. You see a lot of companies. Again, my experience in WeFunder was food and beverage companies. There's a bunch of them that have gone maybe raised $100,000 and they're off to the races. And so I think that type of exposure, like Leah said, decentralization, democratization, platforms, marketplaces, if you will. And not surprisingly, during COVID, if you see the numbers of all these crowdfunding platforms, it's just the amount of money they're raising is, vastly increased, even though you got more platforms out there. And so I think it's fantastic from an entrepreneurial perspective and just for other, peer entrepreneurs. On the unicorn side of it, and there were two other things. I'm sorry, I'm just going to go back and then I'll stop here, that I think are benefits that folks should consider in crowdfunding. One is, I genuinely say this, we have 84 testimonials posted on our WeFunder page from people that invested in the round and otherwise. Those many times are more valuable than the money we got. I mean, I have that as a marketing piece to a lot of folks, whether it's, it's usually in capital raise situations, but when they're hospitalists and internists and doctors and nurses and caregivers saying this stuff, it's hugely validating. And then the second thing is, we've had the experience twice where someone tiptoed in with some obscure amount, a couple $100 or $1,000 or some dollars in the crowdfunding campaign. And subsequent to that, after the campaign was over, contacted me to consider a follow-on investment. And I've written the email, drafted it, and before I click send, decided not to essentially be like, no, sorry, because I'm thinking we are only raising money from accredited investors right now. It's probably not going to be applicable because these are unaccredited. So I simply delete and re-ask the question, are you an accredited investor? And both those times they have been, and both those times, I mean, I'm talking like $40,000, $25,000 checks have been written, one from a prominent intellectual property attorney who serves Fortune 500 companies. And so there's, in my last venture, I think there was like 60% of the people made follow-on investments. So that's another two benefits that I think everyone should not be dismissive of. A lot of people want to kick the tires and want to invest small, see how you're behaving and how you're operating. They can do a little bit more due diligence and then make a bigger splash with a bigger investment check.
Great. Thank you. Well, let's get a real venture capitalist. Gary, you had your hand up.
Thanks, Uli.
What's your comment, question?
I figures my dogs would start barking immediately. So you guys can hear me, right?
Yeah.
Okay, great. No, I mean, this has been a great presentation. And Arup, thanks for mentioning the fund. This is the whole premise in which we created the fund and the network, right? It was the idea of promoting active participation by clinicians and democratizing the investment process. My pitch has always been, when was the last time Kleiner Perkins knocked on any of our doors and said, I have the next Google in healthcare, you want to throw some money into my venture fund? Never, right? So that was the premise. But crowdfunding has arisen for a reason. And so crowdfunding has arisen for a reason. And the reason is that whole democratization concept. So this is real important. But, again, just my background real quick is I've worn every operator hat there is to wear. I'm a serial entrepreneur. informaticist for a 27 hospital system, and now I'm the founder of a venture fund and a global network. So I've been in all those spots. And the one thing that is important to realize if you're looking at from a startup perspective as the person or the group of people who are running the company, you have to also think about bandwidth, right? Probably one of the most high bandwidth requiring events that a CEO has to do, especially in an early stage company, is raise money. And it's not easy. It takes a lot of time. And believe me, you're talking to somebody who's raised probably $30 million from doctors over the last 25, 27 years, right? So it takes a lot of work. And we even did it with our venture fund. It's one by one by one. You have to talk every investor into making that investment. But those are accredited investors, right? With an SPV or with a venture fund. Whereas now when you democratize this process, more inexperienced investors and also non-accredited investors. And still, yes, these platforms make it easier to market to them, but it's still a lot of work to get there. So for early stage companies, you've got the bandwidth. Leah has it, Craig has it, they're early stage, been there, done that. But the minute you get to a point where now your company is beyond MVP, and you are scaling your company, your job to your investors is to make your company succeed. And I can tell you, it's not by spending a lot of time raising money. That's called a Ponzi scheme. You know, they need revenue. And that's why when you're dealing with experienced venture capitalists or even with SPVs, your responsibility, and your fiduciary responsibility is to your investors. So the idea of crowdfunding being a solution at those later stages is kind of a little crazy. You know, but and the last thing I'll say, and then I'll shut up, is that what's really important too is, and this is what we're doing with the fund. I'm glad to hear that what you said, Yuli, about the idea of creating a crowd fund. Well, what we're looking at right now on the network side is it can be a combination of all three moving forward, but somebody else should be doing the work for the CEO, not the CEO and the management company. So if all of a sudden, if we're going to raise $5 million for Craig, there's no reason that $1 million couldn't come from a crowd fund, $1 million couldn't come from an SPV, and then the fund puts in the other $3 million, because then you get clinical validation from the individual investors, and it makes the institutional investors more likely to invest. That's the whole premise of our network, right? We're trying to avoid those Theranos kind of investments. If she had one pathologist on that company, we would have saved billions of dollars. So that's all I'll say is you got to be very careful as an investor and very careful as a CEO as to where you are stage-wise and the risk you're taking. That's my comment.
Thank you, Gary. If there are other investors, angel investors or VCs on the call here, please raise your hand so that we can come back to you.
I was going to follow on with what he said. There's a question in the chat. You know, what would you do differently? You know, entrepreneurship is very lonely. And one thing I think that I do miss, having done a crowdfund, is that when you choose an institutional investor partner who has experience, they also bring their experience and their advisement and their network. And, you know, I've read, I think, every startup book in the world. I spend my, days listening to audiobooks and podcasts, trying to like absorb the knowledge that is out there, because I have advisors, but not in the same way if they were, institutional investors who had done this over and over again. So that is the one thing that's hard about starting with the crowdfunding. You're kind of like still on your own, Yeah.
So it's a lonely journey.
Yeah.
Yeah. I get that. Okay. So I see that for Craig, it's going to be a big round that's coming up right now. That's active right now, 5 million, right?
Correct.
Arup, what's your next step?
Next step is we're wrapping up this crowdfunding. We're working with institutionals on a similar sized round.
Which will be when? Right after?
Right. Yeah, this quarter.
Okay.
Yeah.
Okay. How about you, Leah? What's your next step?
So we just opened up our 2 million seed round so that we can have, 18 to 24 months of runway and not have to spend our energy raising capital for a little while. We can spend our time on product and physicians and actually getting some people to use the Evercred system and potentially pay for it sometime in the next 12 months.
Hey, actually, I got to ask here is that,
yeah,
since, several of us, we're all.
Do you want to ask Gary some money?
Well, that I'll have a separate conversation with him on that.
We'll end up coming to me.
We'd love for them following on in this next round. But as we are, all of us raising money here, and we've got a crowd of some 60 or so people on this call, of which many of whom are physicians and tied in the healthcare community. You've seen kind of what we do, and I would ask you as well, when you're looking at those people in the institutionals, about giving them a heads up, because the warm introduction is so much more than coming in cold. And that warm introduction gets back to what I was talking about before, that affirmation from people who feel the pain. You all are physicians, you understand what we're doing, can appreciate that. And if you relay that to the people on the business end, that gets their ears up that, somebody I trust is actually saying that there's a there. Yeah. Let me come in and take a look.
Especially if you're their primary care doctor or something.
There you go.
Leah, what's your advice to somebody? And let me put it this way: what would be an ideal startup for crowdfunding?
In my opinion, it's something that you can see and touch. Kind of like what Craig has. It's something that's very tangible. It makes sense to people. It doesn't require a lot of explanation. Even Arup had a little bit of a difficulty in the beginning with some of the crowdfunding sites. They're like, well, do people even really want this? Like, seems kind of obscure. And that's in part because it was not a tangible thing. It's really hard to explain something that's totally new, that's never been done before, new technology, solution to a problem that people think there is no solution to. But I was able to move some people to believe. But it's a much easier when
it's harder
people thing. Yeah. Something they can touch and feel and see in action and that kind of stuff, personally, I think. Yeah.
Craig, what would be an ideal startup for crowdfunding, in your opinion?
Yeah, I'm a big guy, and just saying from my experience, because everyone's got their own. We were early. We were, there was a pandemic, and we couldn't go into institutions. We needed to have some customer validation, and so, we're a pre-revenue device. But as I mentioned earlier, a lot of lifestyle businesses, I think it's so great that for folks like that who cannot get an SBA loan, from a local bank, they don't have an uncle or a parent or whomever to get a loan from. I think it's for anyone like that, and I think it's a great, I'll give the platforms a lot of credit in regard to, they do ask questions and require, a semblance of, credibility of the story. It's something that they need to be buying in. They'll say it's because they want to make sure that the companies going on there are successful with their capital raise. But I just view that in general, like anytime there's an obstacle put in front of you or more requirements put in front of you, look at it as an opportunity to become better as an organization and with your strategies and plans. But I really do believe for lifestyle businesses, it's excellent. And I do think what Arup said, look, we did a video that was, tear jerking in some ways, and really playing and pulling the heartstrings. And if you do have a direct to consumer technology that you can convey that story, videos are amazing. I think that's a really good spot to give it a whirl as crowdfunding.
Right. Arup, same question. What would be an ideal crowdfunding startup?
First off, I would think it's a company that's B2C. So it's going straight to the consumer, because the consumers are the ones who can then directly invest in you. So that's first, providing direct benefit to the person who's investing. Second, I would look for something that has, kind of a broad understanding and appeal to a large audience, but has to have a significant niche that could be very devoted to it, that's super excited, because they then serve as your catalyst on the crowd. Oh, I love this, because of X, Y, and Z, and they can start that steamroll that other, get the snowball rolling, and that others can pile onto it. I think those would be my recommendations.
So you need super fans.
You need super fans, yeah, because the super fans are the ones who will get that attention. For when people are just like, hey, yeah, that sounds good, that may not be enough to get them over the hump. But when somebody says, I love this, they get going, and then others kind of will, use them as a surrogate for vetting it. Oh, well, if they're on it, well, then I want to get on too. Okay.
Next question, Leah. Regulation A versus not. What was your thought process behind that? What do you think?
Well, we did a Reg D side by side with the CF. Reg A, I don't remember what Reg A stands for. I should.
That's the bigger one when you're trying to raise more than 5 million.
Yeah. So yeah, we didn't want to raise too much because we didn't want to give too much of the company away. I have this vision of keeping this a physician-owned company. I'd love to still actualize on that vision. So, if there are accredited investors in the crowd who want to come on board now, we might also do another crowdfund, and we might also do an ICO. But the only way that we're going to do that is if we have enough physicians that are on board and excited about it, because ICOs are only valuable when there's a big community behind them.
Yeah. Okay. Craig, regulation A versus not.
Yeah, I know my alphabet, but these regulations, I can't commit them. I was talking to, we're doing something Reg D right now with our attorneys. But anyway, I think when we elected to start this, I don't think the 5 million. I think that just started in January, something like that. So I think we were Reg CF. Yeah. I think that's what it was. I knew we could raise up to $1 million.
Yeah, you were Reg CF.
Yeah. Thank you. And so we had to do like a review financials. I don't admit it publicly, but I'm actually a licensed CPA. So that didn't scare us, getting that done. And so we just thought that was the right path. See if we can raise $1 million, and then we'll, figure out things from there. CF seemed to work for us.
Right.
And the fact that Reg CF is now expanded to 5 million. Yeah, that gives people a lot of leeway for capital.
But the question is, let's say you need to raise 5 million. Would you go with Reg CF or not?
Well, if you were looking at a Reg A, which can raise more, there's a whole nother level of burden of work that you need to do, documentations and filings, and then once you do it, you're. My understanding is you're kind of like a public company, and all of these other things that you're beholden to. So.
It's a lot of work.
It's a lot of work, and there's a lot of costs in that.
Yeah. Okay. All right. At this time, I'll open up the audience for questions. Looks like Gary has his hand up. Or did I forget to put it down?
No, I have one more comment. I actually did forget to put it down, but I do have one more comment.
Okay.
So when you asked that question, I have to tell you, so we invested in Elemeno very early on. I mean, but it was still a seed investment at the time. And I remember when the Reg CF was unfolding and Arup came to us and told us that he was going to do a crowdfund. And my first gut reaction was, he is the perfect company to do a crowdfunding. Because as he said, if you look at healthcare, which is what this group is, right? Yeah. The investors are the ones that you want to get to are the ones using the technology. I know that better than anybody being informaticist trying to sell Epic to 27 hospitals, right? So for me, I knew that the minute that he got out there, any nurse, because it's really the nurses that use Elemeno's solution. They're at the point of care in the tent outside the ER in the middle of a pandemic, and the policies are changing day by day by day at the early part of this pandemic. And he was in a perfect place with an amazing solution to solve that. And the minute it went out on a crowdfunding environment, you told us, Arup, right? How many nurses invested in your company? A lot.
Yeah,
right?
A lot.
And
yeah.
and it's the same it was again the same premise with our fund, the idea of targeting the investors based on the investment. So for me, crowdfunding is perfect for healthcare, and it can be combined with other forms of investment. So I think it's a great source, especially the last example that I had was just a week ago. And we were looking at a company, and this is a brilliant idea. So we all know about nursing and traveling nurses, right? We've all worked with traveling nurses for 20 years, right? Their biggest problem is not finding a job. It's not trying to find a locums company that helps them. It's getting a place to stay where they go. So there's a company that started a B2B for nursing staffing. And the minute I saw that, I was like, oh my God, this is a brilliant idea. And they're very early stage. And they came to us for funding and they were too early. I said, you need to do a crowdfunding. I said, because traveling nurses will throw money at this because they understand the problem, whereas the hospitals don't necessarily understand the pain.
Great.
So that's all I was going to say.
Thank you. Thank you. Let's see. Let's take a question from Salah Heldon. Salah, go ahead.
Yes, I'm Dr. Halasa. My first name is Salah Haldani, right? And I have huge access to A4M. I don't know if you know about this organization, Dr. Klatz. And we are working together to raise money to develop chronic disease prevention management centers all over the country. I already have 10 centers in United States, State, and I have one in Bahamas, another one in Germany, but I want to expand. And we're looking for $100 million. And I put a business plan where I can satisfy the investor because they're looking for hard investment. So I put 50% of that money goes to the buildings, so the centers. So that would be kind of hard investment collateral.
Yeah.
And then 40% for staffing and operation and 10% for products. But the protocols are very unique. It include all the cutting edge medicine to manage chronic diseases across all medical specialties. And I have the interest of the doctors. I just need that investor who's interested to make a change.
Good. Good. I mean, congratulations so far for your work. And yeah, please post it in the chat box. And if there are investors, I'm sure there are. Gary is here. I'm sure there are many more. So please post it there. Up next is, by the way, thank you for joining us. Up next is Pankaj Jain.
Hey, hi, Ole.
Hi.
Hey, yeah, I'm Dr. Jain, Pankaj Jain. I'm a pediatric cardiologist based here in Arizona. And just a question and comment. So, Arup, congratulations on your great product. And regarding this funding, I think still, we did try. We are planning to go to this, crowdfunding channel, but I have co-founded a company on care coordination, which is a SaaS platform called Rovi Care, helping patients move from one clinical setting to any other clinical or non-clinical setting, and we got a very good traction. And I think still the easiest and a conventional way to do seed funding with family and friends. Which really can give that, initial boost to the company without, too much of divergence, I guess. And Arup, I would definitely like to talk to you because our customer segments are, behavioral hospitals. We have also implementing in nursing homes. So I guess other than universities and other big centers, your customer segment, I don't know what are other customer segments. If you are open, we can collaborate.
Yeah, we're covering the full continuum from ambulatory to post-acute care. We're in home care.
Yeah.
So absolutely, love to talk synergies. And you just post your email in the chat, and I'll ping you.
Thank you very much. I appreciate it. Yes.
Great. Thank you. Thank you very much. And you may want to get in touch with Craig also, because he's serving nursing homes and other places too, right?
Yeah. He's a cool product. Yeah. Excellent.
All right. Any other questions? Please raise your hand and so that I can see you. because there's a big crowd. All right. I don't see any raised hands. Okay. So this is the final question. Oh, Carmen, go ahead.
Hi. We're actually working on an NIH project for long haulers for COVID, where we're trying to help them in their pursuits of kind of creating an application and a storage mechanism for all the research and for X-rays, CAT scans, and such in a data center and mobile app. And if anybody could have any experience to lend in terms of, on the 26th is our final review from the advisory council. First release is 4.8 million. If for a prototype, next is 26 million. But anybody with NIH experience that's interested in valuing long haul, comorbidity factors and creating like a mobile app in an actual data center where we store all the X-rays and CT scans and stuff, and do advanced things associated with that, I'd love to be able to
Sure.
have help. And thank you for bringing me on.
So make sure you post it in the chat so that people can see you. All right, Jack Higgins has a hand up. What's your question or comment?
Thank you, Lee. I mentioned earlier that we have a nonprofit telehealth network with volunteer physicians providing consults for health workers in underserved areas, starting in East Africa, basically. We're starting a for-profit social enterprise as a Delaware Public Benefit Corporation. And I wanted to see if anybody has comments about the risk or benefit of having a public benefit corporation when you're looking for money through crowdfunding or through angels or institutional investors.
I would actually love to hear this answer from Gary or any other institutional investors, because I've been told, well, we actually very strongly considered doing a B Corp. And part of why we didn't was because, it's harder for institutional investors. We didn't want to hurt our chances in the future. So we heard. But I don't know if that's really true. So I'd love to hear from people who know more about that.
Well, maybe our next audience member, Mary J. Potter. Mary, go ahead, unmute yourself. Maybe you can answer the question.
Sure. Well, again, I think a good point was made earlier. Things have changed dramatically. A few years ago, doing crowdfunding was really
by the way, go ahead.
Focused.
Go ahead and introduce yourself. That way people will know.
Oh, okay. Mary Jo Pottery. I'm a general partner at Kretsu Capital, and I'm managing director of Healthcare Angels and an LP and with Band of Angels, et cetera, et cetera.
Right.
So I'm an angel investor in the healthcare space for about 20 years. And I'm a real believer in crowdfunding as an entry point, especially for B2C activity or B2B, or maybe a better way to say it, B2B2C, where the people themselves can either use the product, test it with you, get engaged. There's a lot of pluses around that. And the fact that some folks have raised some good funding around crowdfunding because the SPVs, we don't have all the hassle factor anymore. So I think it's a good vehicle. I had asked, I just didn't know if anybody had been involved with Microventures or Red Crow, some of the other entities. You've mentioned the three that were the most commonly used, which is what I've heard as well. I was just curious, especially with Red Crow. I think they're a good vehicle to get some momentum. So I wondered if anybody had used them.
Yeah, MJ, I just wrote a response on there. I meant to post it earlier, so you'll see it in the chat. But we have been with Red Crow. I like Brian there and Aislinn. I think with a lot of things in life, it's all about expectation, right? And so our expectation in going on there was not one such that they would be driving traffic and investors to us, even though I believe they'll, promote that or dangle that. And also, I want to be clear that when we joined their platform, it was really at the end of our crowdfunding campaign. And so for this year, we've elected to stay on there and continue to be a company that has its, what they call, and we call Story Vault on there. I think it's an excellent presentation of the company because I think the interface does a great job of having concise presentation, videos, some documents. It's not necessarily a due diligence room per se that's like Dropbox with due diligence files, but I don't think they've wanted to go that far. And I can tell you that there are some tools that we use on there that can be effective in, I guess, monitoring if somebody is really looking at you or not, and looking into your information, which I think is important to make sure in good faith if investors are really taking a peek at you or if they're not interested. And so we've used it for those uses. I think only recently, because I had the call with Brian and Aislinn 2 weeks ago, they are at the point of incorporating a button like an Invest Now button. I don't think they had done it to that full length before, and we've just opted not to because, again, we're not interested in unaccredited investors anymore and managing that. They may have some belt and suspenders to limit that, but we've not chosen that route just because if we're doing rolling closings with investors writing 100, 250 grand checks, they can ACH and wire us and we can DocuSign the docs, So
great. Thanks, Craig. Mary J, what is your experience, when you see startups who have gone through crowdfunding? Can you shine a light on a few that you think were successful?
Well, yes, I think there's a much more positive reaction to it now because, again, it's a step towards engagement with investors. And it really now, because of the SPV world, communicates a level of sophistication that it didn't in the past, because now even the angel groups are using SPVs more. So all of that has made it much easier, I think, for folks, especially in healthcare. Now, that's true of what I'll call med tech and health tech. It's not so true in biopharma. That's just not the place for crowdfunding, but it is for some of the med tech kinds of things, especially if you're not going to need $50 million to be fully commercialized.
Yeah.
So it all depends on the nature of the beast.
Yeah. Thank you for that
Sure.
insight. Okay. Now I think we're coming close to our end of the program. Let's see. Any other questions?
Can I just ask Dr. Gary about if he's related to Dr. Goldman, Robert Goldman, the founder of A4M?
There's lots of Jewish Dr. Goldmans in the world. No, I'm not. I know Goldmans in every subspecialty there is.
And half of them are VCs, so
exactly.
Go figure.
But Yuli, while you got me on, I just want to say one other thing. And there's a really relevant other piece of information here too, again, that's related to stage. And it's due diligence, okay? So, and that's why to me, crowdfunding is important because, crowdfunding gives you the opportunity to put $1,000 into a company. You don't have to take a huge amount of risk no matter who you are. But on the downside of it, what it doesn't give you really the opportunity to do as an individual, which is also the same for SPVs, is really do the level of due diligence as if you were a venture capitalist, where we spend huge amounts of time and money doing that. So it's important from the investor perspective to think about it that way. But at the same time, it gives you the opportunity to almost create your own personal venture fund, because you could pick 10 companies and you could put, if you were going to invest 10,000 in one company, you could put 1,000 in 10 companies and diversify your risk a little bit. The only thing is that you're missing that ability to do the due diligence. And that's where the advantage of a venture fund or even an SPV or a group of angels comes in. So it's important to just understand that.
Yeah. Great. That's a great point. Thank you. Okay. We want your last word. I'll start with Craig. What's your last word for our physician innovators?
Yeah, look, there's, as we've said, over 50 platforms out there. Do your due diligence. I think making sure that if you're contemplating crowdfunding, make sure the platform caters to healthcare oriented, businesses and opportunities. It is a field that is technical in nature, and not a lot of, not a lot of individuals or unaccredited investors who are not in healthcare may understand it. That said, there is social impact. And if your venture is, on the ESG spectrum, a social impact venture, or direct to consumer, as we had mentioned, I think crowdfunding, you should look long and hard. I do think the dilution thing, it does have some merit, but like is true with a lot of this stuff, your first money can be your toughest money to raise. And so why not do crowdfunding if you want to give it a shot, if you haven't been successful, if you don't think you're a VC play, or even something that's appropriate for the angel groups, let the masses, give you the seed funding that can put you in a spot to give you more options from there as to how you want to raise capital from there. So happy to be a resource for anyone on this call. I think I gave my email address earlier in the chat, and thank you all for your time.
Thank you. Thank you. Arup, last word.
So healthcare is a royal mess, and nobody knows that pain better than those of us who are in the midst of it. But we have to also, reconcile that with fixing that with a struggle that we all have. It's a long haul to become a doctor. You do all these years and years of training to go into medicine, and now you're practicing, and you say, man, this thing is messed up. But I should just keep plugging away at doing this because that's what I trained all this for. And, we have this Hippocratic oath idea of first do no harm. It's kind of like the idea of don't take any more risk. So we who understand the problems better than anyone need to be the ones to fix it. But it is so hard to make that leap, to do something with risk and to innovate. So my last words would be, we need more people like you all who are innovator MDs.
Thank you. Thank you. Leah? Last word.
I second that. It was very hard for me to take the leap. And I kind of did it, haphazardly. I actually took time off to take care of my mom when she was sick. And I had the time to think about this and work on this and talk to people about it and consider the possibility outside of the space of going into the ER and working every day. I'm really glad I did it. I feel like our platform is giving all physicians a chance to unplug and untether from the systems of disempowerment that we've been forced into. I hope everybody here at least signs up on our website to get our newsletter and to come be a part of the network and stuff. But I agree, one of the things on our social feed that we do have, we have a button that you can hard press it and say that something's actionable. And we added that feature because eventually, once we have a critical mass, we're going to push people into private rooms and allow them to discuss what is actionable about that. Is there something going on in your health system that needs to be discussed? Is there some piece of legislation in your state that needs to be discussed? Is somebody experiencing sham peer review? Is there a patient population that needs to get some kind of special attention from somebody? So, we are people of action. We chose this profession to heal people from death and permanent disability. And so we now have the duty. Somebody actually wrote an article about HPEC and said, this is Hippocratic Oath 2.0. 2.1 was, put the patient first, do no harm. 2.0 is now we must build, design, and deploy the systems that are going to fix, this current mess that we're in. And so, take that leap. And, it's not an easy journey, but it'll be worth it. Because at minimum, you'll learn something and you'll be able to take those learnings elsewhere too. And at maximum, you can change the world. So.
Thank you. Thank you. Thank you. Craig, Arup, Leah, you are our heroes. So thank you for taking the time to educate us and enlighten us.